morning, students. Myself Navjot Kaur, vocational trainer. I'm working at school GSS Akkamwali. Today we'll discuss the 12th class 2-year pattern, Unit 2, LO6, surgical dressing. First of all, dressing. Definition of dressing. A dressing is a protective covering applied to the wound to prevent infection, absorb, discharge, control bleeding and avoid further injury. Dressing ਪੱਟੀ ਕਿਵੇਂ ਕਰਨੀ ਹੁੰਦੀ ਆਪਾਂ ਜ਼ਖਮ ਨੂੰ ਜਲਦੀ ਤੋਂ ਜਲਦੀ ਹੀਲ ਅਪ ਕਰਵਾਉਣ ਲਈ ਅਤੇ ਉਹਨੂੰ ਸਾਫ਼ ਸੁਥਰਾ ਉਹਨੂੰ ਡਾਇਰੈਕਟ ਕੰਟੈਕਟ ਇਨਵਾਇਰਮੈਂਟ ਦੇ ਵਿੱਚ ਨਾ ਹੋਵੇ ਜ਼ਖਮ ਦਾ, ਇਸ ਲਈ ਆਪਾਂ ਪੱਟੀ ਕਰਦੇ ਹਾਂਗੇ। ਆਬਜੈਕਟਿਵਸ ਕੀ ਰਹੇ? ਟੂ ਕਲੀਨ the wound, to prevent entries of microorganisms into the wound, to give rest to the part so that the wound heals early and well, to use local medications so that the wound heals early and well, to remove slag from the wound, to bring the edges of the wound together by pressure. ਮੇਨਲੀ ਕੀ ਹੈ ਤਾਂ ਕਿ ਆਪਣੇ ਜੋ ਜ਼ਖਮ ਹੈ ਜਲਦੀ ਤੋਂ ਸਾਫ਼ ਸੁਥਰਾ ਰਹੇ, ਮਾਈਕਰੋ ਆਰਗੈਨਿਜ਼ਮਸ ਦੀ ਐਂਟਰੀ ਉਸ ਦੇ ਵਿੱਚ ਨਾ ਹੋਵੇ ਅਤੇ ਉਸਨੂੰ ਜਲਦੀ ਤੋਂ ਜਲਦੀ ਹੀਲ ਹੋ ਜਾਏ ਅਤੇ ਜਿਹੜੀ ਮੈਡੀਸਨ ਹੈਗੀ ਉਹ ਉਸ ਦੇ ਉੱਪਰ ਟਿੱਕੀ ਰਵੇ। ਅਤੇ ਆਪਾਂ ਕੀ ਕਰਨਾ ਹੈਗਾ ਤਾਂ ਕਰਕੇ ਆਪਾਂ ਡਰੈਸਿੰਗ ਕਰਦੇ ਆਂਗੇ ਅਤੇ ਉਸ ਤੋਂ ਜੋ ਵੀ ਮਤਲਬ ਕਿ ਵੇਸਟ ਹੈਗਾ ਵੂੰਡ ਦੇ ਆਲੇ ਦੁਆਲੇ ਜੋ ਵੇਸਟ ਆਉਂਦਾ ਉਸਨੂੰ ਕਲੀਨ ਕਰਨ ਲਈ ਆਪਾਂ ਡਰੈਸਿੰਗ ਕਰਦੇ ਹਾਂ। ਅਤੇ ਜੋ ਐਜਸ ਨੇਗੇ ਆਪਾਂ ਬਾਈਂਡ ਅਪ ਕਰਦੇ ਹੁੰਦੇ ਹਾਂ ਡਰੈਸਿੰਗ ਨੂੰ ਤਾਂ ਕਿ ਜੋ ਐਜਸ ਨੇਗੇ ਦੋਨੋਂ ਟੋਰਨ ਐਜਸ ਨੇਗੇ ਉਹ ਇੱਕ ਦੂਸਰੇ ਦੇ ਨਾਲ ਚਿਪਕੇ ਰਹਿਣ ਅਤੇ ਜਲਦੀ ਤੋਂ ਜਲਦੀ ਉਹਨਾਂ ਦੇ ਵਿੱਚ ਹੀਲਿੰਗ ਹੋਵੇ। Characteristics of efficient dressing. It should be sterile. It should be soft with proper pore to allow the oozing of discharge and sweating. It should be large enough to cover the area of the wound and extend about 2 to 5 centimeter beyond it. Types of dressing: adhesive dressing, non-adhesive dressing, gauze dressing, improvised dressing. First of all, adhesive dressing. It is sterile, consists of pad of absorbent gauze of cellulose held in place by a layer of adhesive material. It is available in different sizes and supplied in papers. Method of application of adhesive dressing: remove the outer wrapping and hold the dressing gauze side down. Peel back and expose the gauze and place the pad onto the wound. Press the ends of and edges down. Non-adhesive dressing: sterile, ready-made dressing. It consists of layer of gauze covered by a pad of cotton wool with attached roller bandage to keep it in position. Number 3, the dressing is scaled in protective cover available in different sizes. Methods of application of non-adhesive dressing is: first of all, remove outer and inner wrapping, unwind the bandage and open the dressing. Place the dressing on the wound with gauze side down. Bandage firmly until the pad is covered. Secure the bandage by tying the ends over the pad or with the plaster. Next, third one is gauze dressing. Gauze is commonly used in layers. It's for large wounds. It helps in clothing. It is good absorbent, soft and pliable. Method of application of gauze dressing is as same as non-adhesive dressing. Improvised dressing. It is used in first aid emergency when prepared dressing is not available. Any clean, dry, absorbent material can be used, such as inside of clean hand handkerchief, towel, linen, clean paper pads or cellulose tissues. Such improvised dressing is placed in position by a suitable material available. Do not place cotton ball, lint or fibrous material directly over the wound, otherwise the fibers can become embedded into. Antiseptic medicated dressing. General rules for application of dressing: wash hands before dressing, clean the wound and its surrounding skin if wound is not large and bleeding is under control. Avoid touching the contaminated wound and dressing. Never cover sneeze over the wound. If necessary, cover with non-adhesive dressing with pads of cotton wool to help control bleeding and absorb discharge. Always place the dressing directly onto the wound. Never slide it on from the side. Do not remove dressing. Add new dressing over the top of blood dressing. Contents of dressing trolley. Next is contents of dressing trolley. Upper compartment of the dressing trolley. There are three drums. Drums are drum of sterilized towel, drum of sterilized cotton, drum of sterilized gauze, box of roller gauze, a bottle with Dettol solution, and chital forceps jar of water which has been boiled and cooled, ready lotion, swabs. Next is lower compartment. In lower compartment there are plain dissecting forceps, tooth dissecting forceps, artery forceps, sinus forceps, probe clip removing forceps, small valves, tray with pure Lysol, and sharp instruments such as the following: scissors, suture removing scissors, knife, needles, small and large, both. Then next is side ring of upper compartment. Bottles containing the following: hydrogen peroxide, gentian violet, use sole, bandage, cutting scissor, kidney trays 8 to 10, magnetosh small and large, sticking plaster, bandage tray, Vaseline jar, tubes of antiseptic cream, ball of lotion, bucket for waste. Things to remember while dressing: hands should be washed well before dressing a wound. If more than one dressing is to be done, hands should be washed well before after each dressing. Dressing should be started after the word has been cleaned well. Clean wounds should be dressed first and dirty wounds should be dressed afterwards. Dirty wounds require frequent dressing as per the doctor's instructions. Time, energy, and things should be used without wastage. Dressing material should not be used wastefully. Stains of sticking plaster and lotions should be removed from the patient's skin with spirit. If the old dressing is adherent to the skin, it should not be pulled off with force because that is painful. It should be removed by application of ether to to under surface in contact with the skin, or by moisturizing the saline with the saline. Lotions should not be poured from a big bottle directly on the wound because it is possible that it may spill much in excess of the need. Lotions like use so should not be used if they are old because the chlorine in it has gone by the that time and it is not more effective. Bottles containing ether and spirit should have screw caps. All bottles should have labels written in a legible hand. The following information should be maintained on the label: the name of the lotion, the strength of the lotion, the contents are for external use only, name of the word poison if the lotion is poisonous when taken orally. Steps for dressing: preparation of dressing trolley. First of all, we will prepare the dressing trolley and isolation of the patient with a screen around his bed. Next is positioning the patient and placing a macintosh under him, removal of old dressing, then hand wash and wearing sterile gloves. Next is clean the surrounding area of the wound, cleaning the wound, dry or wet dressing, application of the bandage or adhesive plaster. Methods used for dressing: The dressing trolley is taken to the patient when it is properly arranged. The method of the dressing is explained properly to the patient and his relatives. A screen is placed around the patient. Appropriate position is given to the patient. Macintosh is placed under the patient. Only the part required is exposed. The old dressing is removed and put in the bucket for waste. Hands are washed. Gloves are washed. Sterile towel is placed under around the part of the dress so as to prevent soiling of the patient's clothes and bed clothes. The skin around the wound is first cleaned with detergent solution, holding the swabs with sponge holding forceps. The swabs are moved from the center to the periphery. Each swab is used only once. Any adhesive transferred to the skin for the sticking plaster is removed with the swab soaked. The wound is cleaned, then dry or wet dressing is applied to the wound as per the doctor's instructions. Then it is covered with gauze and bandage or adhesive dressing is applied to it. The used instruments are placed in the kidney tray. Thank you.